All right. Okay, we're here for a very exciting interview with Dr. Verna Hunt, ND, and I'm Dr. Sonia Doherty, ND, and my sister, Dr. Krista Doherty, ND. And we have Ileana, my
Hi.
daughter, because we had the privilege of hanging out with Dr. Hunt in Saskatoon. And I'm hoping we can get into just like a great story about why it's so important that we need to learn more about how to assess our patients with our hands and put our hands on our patient, which you always say, Verna, and we're just really excited to hear what you want to share with our colleagues and hear more about your legacy project.
Great, that's great. So, hello to everyone out there in uh what's the name of your group now? Let's see. Excellent
Oh,
ND.
exceptional NDs, yeah.
Exceptional NDs. Exceptional NDs to everywhere across the globe. Somehow we got to get this hooked up with the World Naturopathic Federation.
We'll talk to Iva. Yep, she's our next stop.
Okay, good. Good.
Yep.
Yeah, we need to have access to information. That's why I'll start with the Legacy Project. Every time in Africa, they say every time an elder burns, I'll start again. Every time an elder dies, a library burns down. And I think the translation, it translates into library, but I don't know indigenously if most Africans had a library in their little village. But the knowledge, who's the keeper of the knowledge? So we were just at a convention of naturopaths in Saskatchewan, and there were people there from Ontario and British Columbia and Saskatchewan and Alberta and Manitoba, and I don't know if anywhere else. But they opened the proceedings with an elder man, which was really interesting, and they ended with an elder woman, an Indigenous woman who is the keeper of the TP knowledge, and the women keep the TP knowledge. And every part of the TP, every pole, everything has a meaning, which she didn't go into, but I'm very curious about it. And she said that Indigenous women, Cree women, her tribe, the children are born on the land. So they're often born in teepees, which is on the land. And her mother was a midwife, and she went and collected herbs. And wouldn't it be great to know what that mother of Mary Lee knew? Like, you just want to like have a Vulcan mind meld, and see what she knew. And it's just very exciting for me and for many of us to hear that, because we have this phrase evidence-based medicine, which is, I think, a little misconstrued. The fellow who developed that was a man at McMaster University in the early 90s. And he was talking about the experience of the patient living in their body and their life, and the experience of the doctor, and then experience of observational medicine. Because science is medicine. Science is observation. When it comes spring and the sun is at a certain angle, the leaves come out. And people have known that for millennia. I think research is great, but what's being interpreted as evidence-based research right now isn't the original meaning, as far as I can read. So, I have an honors science degree in kinesiology from Waterloo, and a minor in dance and theater that I got in 1973. So this is my 50th graduation anniversary.
That's awesome. Congratulations.
And they sent me a keychain that was about this big. It was square, and it was so heavy that if you hit somebody in the head with it, they'd have a concussion. I'm thinking, this is recreation and phys ed and all this stuff. I just laughed. It was very funny because it's a very dangerous keychain. Anyway, I'm going to write them a little note and say, what were you thinking? So I kind of rant off, so you can haul me back in any moment. But there's so much exciting things that we can save and think about, which doesn't exclude science. It doesn't exclude science. And the more emergency-like medicine you have, the more you want protocols, because if you're bleeding out through your femoral arteries, you want somebody to know what to do first, right? So those things are very, very important, because I've had life-saving experiences with emergency medicine, and I'm really glad it was there. Sometimes patients say to me, "You're going to be really mad at me." And I said, "Really? Like, I'm not a mad doctor." I just said, "Why?" "Well, I took a drug." I said, "And?" well, you don't like drugs. I said, I said that? When did I say that? They said, oh, well, you didn't say it. I said, I've had to take drugs for emergencies, and that's an important thing. It's know when to do it. And I said, if it kept you alive, then at least I've got a warm body to work on. If you're cold, I got nothing to work with. You're not in there. So just come. We'll work from where you're at. Like, I really encourage doctors to not make their patients wrong. And allopathic medicine trains them to do that. Oh, you're wrong because whatever it was they did or didn't do. I've experienced that myself. And it's like, it usually comes from a place of fear, because if something goes wrong, then the patient's done something wrong, not to doctor. It's all about blame. But don't get caught, it's acknowledging what happened, but this blame thing just drags everybody down. Anyways, where were we? Take us back to a question there, somebody in charge.
I don't know if I would profess to be in charge, but I think one of the things we're most excited to hear about is just what you think is, the most impactful, most important information you can share, as your legacy. Like, I love that term. I want to hear more about the Legacy Project. Even just talking to you, I want to learn more about how to assess with my hands and
Right.
treat, or at least be able to refer to the right people.
Right. So if we lose knowledge every one time, our elders are unfortunately not elders, a younger person dies, and we have that in our profession. What are the things that I say this to elders of any age? What are the things that you know for sure, as Oprah would say? What are the things you know for sure that I should know? And I think that's an easy way to share information. And I'll come back to that question, and I ask you to bring me back to that question, but also touch. So it's really important to have a stethoscope and being able to look in their ears and have testing devices that we use in naturopathic medicine. All of those things are really valuable. But what's the thing that you carry around within your body all the time is the ability to touch. So some people don't like touching people, which is curious to me that they're a naturopathic doctor, but I don't know their whole history and psyche. So that's okay. And I have heard from some younger naturopaths during COVID that were in telehealth and love it. And they don't want to go back to in-person because they don't want to touch people. And I go, inside me, I go, I think you're in the wrong profession. Like, what did you think was going to happen here? That you wouldn't touch people? And so that's just a question to throw out there. And things change over time. But we're human beings. We live in a physical body. We can touch, taste, smell. I've got 5 senses. Touch, kinesthetics, touch, taste, smell, and hearing. And all of those can be used. The way a person speaks. Let's go over this. The way a person speaks. Well, English might not be their first language or hardly have the language. So that's a really interesting thing, because they're probably speaking what I would call street English within their cultural group. So what they think might be a verb in English isn't. So maybe you can have an interpreter, but you have to listen partly by the sound of their voice and where they're pointing. So people come in and they say, my stomach hurts, my stomach hurts. And they point to their pubic bone. They don't know anatomy. They know somewhere in that belly place there's a stomach, maybe, but there's other things. They might not know that, but you're not there to make them wrong and say, well, that's not the stomach. Talking to people like that is very pejorative. It's like you're kind of telling them they're stupid. That's what you really want from your doctor, is to be told how stupid you are. This is not useful in a certain way. So you listen to their voice, and everybody has a certain tone. We each have an energetic note. We each have a way of speaking that you can tell if your spouse or your children or your parents are trying to pretend they're really happy with you, but you can tell they're really not, you know. and yeah, like there's the tone, you know, there's the tone, or the clipped sentence, or whatever. Or people want to talk about things that have to do with physical, non-physical abuse. And I've had clients that I've had for 20 years before they tell me something happened to them as a teenager that was many people abusing them all at the same time. And I had known her so long, and I always thought there was something there. And when she finally told me, I just held an even, you know, I didn't say, well, I thought so. And I didn't do that, but it took that long, and we had a very good relationship. But some people, they can't, it's not safe for the part of them that had the abuse at the age they had it to speak of it. So you can ask them, you know, have you had any kind of abuse? And people say no, because they actually might not remember. They might not remember what's happened to them. And then usually when they're 40 or older, when they're safe within their own personhood, they'll have memories and whatever. So I've had experiences like that with people. So there's the tone of their voice, whether they make eye contact. Some people don't like making eye contact for all kinds of reasons. And so I spend with those people, I look at them, but then I look at my writing, because I'm trying to help them be comfortable. And the sound of my voice and just active listening. Oh, that must have been really difficult, you know, when that happened, you know, that kind of active listening. But sometimes, you know, you're talking to your client on the phone because they're in some kind of urgency because they've had maybe a car accident. And you can tell that they're really shook up by the tone of their voice. So that's an important thing, is listening, active listening. So what one of our colleagues asked me once, a good friend, what is your best modality? We were driving, he was in a car driving, and I was sitting there, and he said, well, what's your favorite modality? I said, listening. He said, no. I mean, is it like acupuncture? Is it this or that? I said, it's listening. And he kept going. I said, you know what? You're not listening. It's listening. Listening is my most important modality. Listening carefully to the sound, to the facial, what's happening with the face. My new client yesterday was 5 years old, and so I have tables that move up and down, and I put her eye level right at my eye level. And the younger they are, 2-year-old, I put their eye level above me, so they're the alpha dog in the room. And they'll open right up. And I have toys. I have really good toys, I have to say. But none of them are dangerous. All of them can be washed. But, you know, if you work with children and you don't have toys, then you're just stupid. Or you don't have children yourself. And you have to change them up. But I have some toys I've had my whole time in practice, which is like over 40, 45 years, because they're such good toys. I should have gotten 500 of them. Anyway, they weren't expensive good. They were just, you know, adults play with them. So listening is really, really important. And I do physical exams. A lot of people now in the last 10 or 15 years don't want to pay for a physical exam. They want a magic bullet, silver bullet. They want something that will abracadabra make them great, perfect right away. Or they come in and they say, well, I'm going to be a bridesmaid in 2 weeks at a wedding, and I want to lose 25 pounds. I said, oh, cut off a leg. They go, what? I said, what is it you want to, what is it you really want? You want to look good in a dress. Is the dress fitting you currently? Yes. I said, well, then you've got, you know, you can change this up in various ways. So I think what you want to look is less puffy, less in your body. Like a lot of women think they want to lose weight, but what they need is their lymph system working, and they would look fine because they're all puffy like they look marshmallowy, right? That kind of thing. But so you're trying to define what you want, what the patient wants. So there's a question. If we were meeting 3 years from today, and this is a question from the strategic coach, if you know Dan Sullivan's question, he developed it. So I just want to give acknowledgement to him. So if we're having a conversation 3 years for today, what would you want to have happen in your life and in your health to be happy with your progress? What would you want? What are the top 3? Some people have a long list, but some people don't even know one of them, you know? And so they might see, I have insomnia, I want to sleep better, I want to not have colds every spring and fall, and not be constipated. And then at the very end, and I wish I wasn't so depressed. That's not on the intake form anywhere. But when you ask them what they want, it's good to ask them what's wrong, what they think is wrong. It's also good to ask them what they want. And, you know, a lot of families, maybe not so much now, I don't know, but, you know, I was born in the early 50s. And I was born on a big dairy farm, and nobody had time to ask each other what they wanted. But when somebody asked me when I was a grown woman what I wanted, I thought, oh, I can say what I want, you know. And it's really important to ask those people those questions. And then you can go back to them in 3 months or a year and say, how's this thing going with whatever it is, constipation. Looks like we've made some progress according to their words. But you might have other diagnoses that say, you know, they have liver and spleen qi congestion and it's affecting their bowel movements and blah, blah, blah. They're not going to remember that. They're just going to know that their bowels are moving, you know. And I'm not saying pejoratively that people are stupid and don't know, but who's going to remember that? It's like somebody talking to me about computers. It's like people say, push the button. I say, there's no button on the screen. They go, there's a button there. I said, nope. I said, there is a rectangular box that says submit. That's the button. I said, it's not a button, it's a rectangle. I'm one of those people. Like, you know, a button is something you sew on a shirt to me. Anyway, so I know, unbelievable. You can imagine I don't have a romantic relationship with computers. So you want to have a good intake with them, and you want them to feel comfortable. And I have people in all kinds of circumstances. They brought their child there, but never call home, call this other special number because the husband can't know. So that speaks volumes. Or they come in because they're making decisions about with a parent, because they're usually under 18. They're making decisions about their gender identity, and they want help with their health while they go through that transition. And that was a fast learning curve, because we weren't taught that, you know. So I get all kinds of different cases, and in my career I've done lots of fertility work, and then lots of other work. So I have an intake form which I, you know, got honed down, the very short one for consultations, and a semi-long one, but an interesting one for new patients, and really try and put it in plain English. I put new things I write out, and I have people that I call street smart people. I say, read that. I say, do you understand what that means? They go, nope, it doesn't say anything that I know about. So always test your writing things with people that are going to read it, that don't know that their stomach isn't by their pubic bone or whatever. So I do an intake, and I have a background in kinesiology and chiropractic and naturopathy. I also have background in mind abdominal massage, which is repositioning uteruses from the outside. And I do lots of things, like I do use a lot of kinesio tape in my office, and just to get people stabilized so they can get over their inflammation. And I do sound color therapy. I have a beamer, which is a pulsed electromagnetic field machine, which helps the microcirculation. I do hair analysis more than I do blood, because hair analysis tells me what's inside the cell. although some people would beg to differ with me on that, but that's okay. And I want to know if there are heavy metals in their toxic metals in their cell, Urine is good, blood is good, but I want to know what's going on inside the cell. I have, I do a lot of other things, but I have a great variety of supplements, homeopathy, tinctures, phytogens, which are like, what's the other name for phytogens?
Or like Gemnos.
Gemos, thank you, big word, thank you. And this is my brain on COVID. And I'm not admitting to having an aging brain, I'm not admitting to it. I use a thing called NanoV, which is a bit of a misnomer, but it helps. It's a signal loaded on water molecules that you breathe in, and it reduces oxidation in the body. It's used a lot with macular degeneration and recovery for athletes and people after surgery, especially plastic-like surgery with all the blood and cuts. And the website for that is www.all_ENG, the number 3 written as the number 3, like, you know what I mean by a number sign, number thing, and corp.com. And that's really, really interesting. I've had that since I saw it at the convention in 2009. It was in Nova Scotia. And there are other machines out there like it, but it really helps decrease oxidation in the body. And I encourage you to go there and look at that. I do orthotics that are made to help you walk through your arch correctly. They're not like a hockey puck under your feet. You can tell I have a little bias there because, you know, who wants a hockey puck under their feet? I mean, it's not forcing your foot to malform, you know, like talk like this or whatever. It's to help you move the foot like a wheel, because it's really a wheel. And Foot Max, I'll just give them a little advertisement. I've used them since the mid-90s. Hair analysis, what else do I do? Probably lots of other things. But there's something else. Oh, I have a jiggle machine in my office. It's a T-zone. It's something you stand on, and it's like you're in gravity walking. And they were originally designed for the people on the space station so they wouldn't lose bone. Men and or women they become very osteoporotic on the space station, so they have to simulate gravity. The other thing that they approached the pulsed electromagnetic machine I use, which is called Beamer, BEMER. NASA approached them to make a kind of undergarment, so they didn't have blood pooling. It keeps the blood moving when they're on the space station, much better. Anyway, so people come in, and some people come in with what you might think is a metabolic problem. I don't know, they have menstrual cramps or whatever. That's a good example, menstrual cramps. They're not so unusual. And usually with that, you ask all the PMS stuff. Do your breasts get sore before your period? Yes. Is it the nipple or the outer or the breast itself? It's usually the breast itself. It's usually the lateral side of the breast. Now, why is that? Why is it the lateral side of the breast in the tail? What's happening in the lymph system? So we all know that we have this lymph system, but nobody ever talks about it. And allopathic medicine, maybe 7 years ago now, said, we've discovered a lymph system in the brain.
The glymphatic system.
You think? Why would nature, Mother Nature, or however you see creation, develop something that's everywhere but in your brain, but your brain runs your body? That doesn't even make any, that's not scientific thinking. Just saying. So the lymph all drains in from the outside, legs up, but the belly and the legs all drain to the right lower quadrant where your appendix are, and drains posteriorly to the anterior side of the sacrum. Are you still with me?
Yep.
Okay. So then that's called the cisterna cali. And if you have pain or something happening in your body that wakes you up at 5 o'clock every morning, before you usually wake up at 6:30, 7 o'clock, 8, whatever, Your cisterna cali is in stasis. It's low back pain is the classical. Very, athlete, lean, fit. And they say, I wake up at every 5 o'clock in the morning, I have the worst backache. I said, is it sharp? No, it's just achy. I said, that's your lymph system. Took me forever to figure that out.
She has that every morning. Every morning she's up at like 4 a.m. She's like,
Love you, Verna. You're amazing.
Which one of you is it?
He's been called out.
Is it you, Sonia, or is it?
I wake up at 5 o'clock every morning.
every morning.
Her room's right next.
So that's, it's a cistern, but it then has to pump up. Now, what moves our lymph? Muscle contractions. And if we're not moving, we're still at night. It has no valves. It has no major heart pump. So it pools there. Now, what does it do from there? So we're on the front side of the sacrum and the lumbar spine. Use your imagination. And it makes a tube that goes just left of the spine up the front side of the back ribs. So just think about that. It took me forever to understand this. I keep imagining it. Then it comes up under the ribs, under the collarbone, over the lung, but inside the ribs, and dumps in your left thoracic duct right in here into the main vein system. Because you don't want all the lymph, it's like a sewer. You don't want that going through your liver through the portal vein because it's already got problems. Get that stuff from the food. So the head and the right arm and right breast, or maybe half and half in the head, I've seen both, go through the right. And so when that's not draining well, it's like, the hose around the house where you're watering the garden in the front, now it's stopped and you think, oh, gotta walk all the way around the house and there's a twist in the hose or there's something impeding it. You have to get the drainage working. So you always have to start with the drainage up in here before you try and figure out drainage anywhere else. And if this isn't draining, and that thoracic duct tube is coming up to dump in it and has nowhere to dump, where does it put it? In the side of the breasts. Because it's got nowhere else to go. So the breasts are sore. So if you have sore breasts before your period, and it's that lateral tail of the breast, the liver isn't deconjugating the estrogen, etc. well, and so you're more water retentive, but you're also probably having lymph congestion, especially if it's one breast, especially if it's the left. So when we do thermography scans and we're checking to see if there's abnormal physiological circulation in the breast, the thing you find most often is the left breast has a hot spot because it's just sitting there pooling goop, sewer water. Interesting, eh?
Yeah. Yeah, really cool. Very physical.
Very physical. So here you are. You have a breast that's not draining well, and we should all be feeling not our own breasts in the showers, but our clients. And it can be a classical exam, but you can also just feel like you're feeling for lumps in your rice pudding, Like you get a textural idea of what it might be, because lymph is kind of like lumpy rice pudding feeling on the fingers, as opposed to some obscure description of what you should be feeling. It's really good if you can say, oh, it feels swampy or like lumpy rice pudding. And I tell women that's what they're looking for, because all these very intellectual descriptions that come from medicine aren't always intellectually available to the rest of us. What does it feel like? So then the other thing that can happen in there is that you get a lot of congestion. The breast is congested. The areas that are trying to drain right around it is they have, what do you call that? Frozen shoulder.
Oh. Huh.
So, and the bra strap, you think somebody's tightened up your bra strap on that side, the over the shoulder one? Like you think, what is that? What is that? And it's that there's too much congestion, relatively speaking, in the body there. So then you start to pump the thoracic duct. And that's what I teach in my courses, but I'll come to that. I'll teach those things. But these are like really hands-on things you can do right away while your patients, they start talking and I got them laid down and I'm already working. They're talking because I can tell. I mean, not a new patient. I don't do that to a new patient, but somebody that had been around me for 10, 20, 30. I have a client from 1978 when I was an intern. So, you know, it's a while. It's a while. So you just start working and they're used to me doing that, you know, after a while. And then I ask them all kinds of silly questions. Is your left shoulder hurting? Well, how do you know that? It just scares them a bit. I said, no, it's just congestion. And then the strap pushes down, or the right shoulder. So there was a colleague of ours who'd had a thermography done and she had a TH4 and she was, I don't know how old she was, 35, 40. And I did a Zoom with her with another colleague and she had a TH4, which is like, okay, let's go get an ultrasound or a mammogram kind of thing. And I said, stand up in front of me. I need to look at you standing. And her right shoulder was doing this. I said, what'd you do to your right shoulder? She said, oh, she had this whole physical, it was a tennis, something that had happened. And she had, you know, inflammation in her shoulder and it's never been right since. And blah, 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 blah. I said, the right thoracic duct isn't draining in you probably. So I had her palpated and see if she could discern the difference. Was this giving more pushback than this side? And because she'd even had a mammogram, she had a TH4, then nobody could find anything. I said, yeah, this part isn't draining. This right side isn't draining. So you know, when the thing that drains your soil in a garden is swampy in some area, you can't grow things in there. All the things you do grow is like lichen, mold. No, you don't want that. So that's a way to think about the lymph system. It's like a terrible secret that's been kept because people don't think of drainage, although we think of it relative to homeopathy, but we're not thinking about the physicality of it. And every day, every week, I learn something new about the lymph system because I see somebody with something and every part of their body was fine except for the forefoot on their right foot. And it was swollen literally up to the junction of the proximal metatarsals and the cuneiform bones. And she did yoga, all this stuff. And it was her lymph, but nobody had ever identified it as that. I said, it's not draining. And the metatarsal cuneiform joints were jammed, like stubbed fingers. So I said, well, I'm going to drain this for you. And she was fit in every other way. And I said, you've had body work done and this is going to hurt a bit. And then I adjusted her foot and it went pong, long, long, long. And within 2 weeks, 25% of it was gone. And she'd had it for, I don't know, 5 or 10 years, long time. So there's things that can really make a difference with the drainage. And the reason I started Legacy is I kind of have a real urge. I think it's like when people want to have babies. That never hit me very hard, but I want people to know what I know, not because it's mine. People say, aren't you afraid people will steal your intellectual knowledge? I said, I laugh. I said, it's mine. I just figured something out. If you lived in a remote village and I came and you didn't know how to make a fire, I would teach you how to make fire, or at least I would bring matches. Like this idea that this is mine or my techniques. One of my least favorite things is when we name something after ourselves as healthcare practice. Like the sigmoid flexure, for example. Anyway, yeah. So we want to pass on information. And I've had colleagues die. I was thinking of John LaPlante today, who was alive when I was younger, and he was such a character. Of course, not all naturopaths are characters, but he had a very interesting way of talking about what we never talk about now, about the nuances and about the attitude the person holds that keeps them blocked. And he was just really something. And lots of other elders. Nora Stewart, who had been an administrator in the provincial government, had become a homeopath and naturopath, and she used what do you call that? Radionics. She used radionics machines, which a lot of young people don't even know what that is. Do you know what it is, Chris?
Is that the Nate? Like you hold the
No.
no,
No. Radionics probably started around the time of Tesla and whoever invented other electrical things. Edison, big name, can't remember. And it's been outlawed in the United States, except the military can own it. And when the astronauts are whipping around the moon, if they're on the fly side of the moon, you're out of contact with them, but you can still contact their physiology, etc., through radionics, for example.
Hmm.
Yeah. So yeah, it's like all of these little secrets that we don't talk about anymore, because who knows why we don't talk about it. But we can, that's a whole other big lecture. But so people come in, and if they're coming in as a full on new patient, I give them a report that talks about what they said they wanted, what I found, and what I suggest that we do, which usually involves hands-on therapy, some kind of supplement, which could be a probiotic or something much more complicated, because I do a lot of homeopathic drainage and other things like that. Sometimes it involves color therapy, sometimes it includes orthotics. So I have all these possibilities. But the reason I started teaching was what I just described to you from the lymph system. Even though you might not fully retain all of it, listening to it, now you've started to think about the lymph system. It drains 30% of the blood volume away from the cells. 30%, not 3%, 30%. That's a lot. That's a lot. So if that isn't getting dealt with somewhat adequately, then you're swampy. And that creates a terrain that has abnormal cells. EMFs can affect that. EMFs cause leaky cells because the tight gap junctions in your gut, in your outer skin, around your brain, all of that is being opened up. We have leaky everything now for the most part. And when we don't have integrity in this between the systems, like in the mucous membranes, they can be leaky. And there's a scientist in Sweden, his name's Olle Svensson, and I'm on a listserv from Planetary Association for a Clean Environment that Andrew Makrowski runs. And you can go on his listserv. Anyway, it's called PACE, P-A-C-E, and Ole, this Johansson guy did research. He's a neurologist that specializes in skin. So we know that the skin and the nervous system is formed from the same layer of the embryo, the endoderm, ectoderm, mesoderm. So he's very interested in skin, and he did research that I can't remember if it was an animal research study, but everything just started leaking. It must have been animal research study, but I would have to find it, because I read that, I don't know, 15 years ago. Who can remember what they read 15 years ago? So, but it causes leaky skin, leaky everything. And when I explain it to kids, I use my hands. This is a cell, this is the cell, and they have to keep tight. So your skin is good. You don't want to be oozing out through your skin. And they go, that can happen? I said, yeah, it can happen. You often see it in old people. Oh, like you're, really old, because they get bruised easily and they get stuff kind of weeping out, and they go, oh, so you want to look after your skin. So you're going to learn to skin brush, like you brush your hair and you brush your teeth, you're going to learn to skin brush. And they go, okay, let's go. They're quite reasonable children if you give them a good motivation. And skin brushing helps. There's lots of things that help, but getting the lymph moving by skin brushing is a good thing. If you drink a good amount of water, and good water, and you put a little micro bit of sea salt in it, real sea salt or gray sea salt or Himalayan salt. And you skin brush. I don't care what's wrong with you. Half your problems are gone because you're draining the swamp. Just drain the swamp that you've created. And I hear that so I can hear it too. I say it so I can hear it too. So they come in and we do whatever. And, you know, I very rarely, you know, start at something uber complicated physically, but I always sit down and I'm not a small person and I'm a tall person. So I don't necessarily tower over them. And I have a table that goes up and down and chairs on wheels, and I sit beside them and I put my hands on their belly. I said, so we're going to talk about your belly today. And the belly's really interesting. And I go with a little touch. I say, you have a food pipe, and I touch, just, they have a gown on, or men wear, I have shorts. I have things they change into, or they wear kind of their own sport stretchy clothes. And I say, this is your esophagus, and there's a valve there, like our mouth is a valve, our rectum is a valve. And if you've ever vomited, there's one right at the end there. And they go, oh yeah, and so then you have a stomach, which can be, people say it's shaped like this wineskin, but stomachs can be really different shapes anatomically. And then it takes the food and puts enzymes in, and it mashes it up, but we can't feel it doing that, or it's not good if we feel it doing that. Then there's another valve. It's called the pyloric valve. And then I touch them. There's 18 feet of small intestine, some less, some more. And then over here on the right lower side, I don't use the word quadrant, but because we're talking to each other, we're talking that way. That's where the appendix is, and the appendix have a purpose. We get our biome from our moms, not our dads at all. And our mitochondria, I don't necessarily talk about the mitochondria then, but at some point I'll talk to them about mitochondria, because that's all from our moms. And of all of the lymph vessels and nodes in the body, of all of it, 70% is around the gut. Now that's important. Like, why did they put 70%? They, thank you, Mother Earth, whatever. It's around the gut. So that's pretty impressive. That's pretty impressive. So your immunity begins in your gut. There's things called Peyer's patches, P-E-Y-E-R-S. Look that up, because that's really interesting what they do. They make antibodies, but if you get down, look at Wikipedia, because they have stories that are technical, but most people can read them because they're in simpler English. And when I'm doing lectures, I go to Wikipedia for my definitions, because anyways. So then there's about 8 feet of large intestine. And then, you know, it goes down, it comes up the right side, across the transverse, and down the left side. And then it makes a hairpin turn. Sometimes I call it the design flaw. Like, why did they put that hairpin turn there? And then it goes up a little posterior and makes another semi-hairpin turn and goes out to the rectum. Like, but what happens? What's the difference in the shape of our pelvic opening between standing up and squatting? When you're squatting, if you've ever pushed a baby out, it's a round circle. But when you're standing, it's oval. And have you ever tried to push a baby out of an oval? Doesn't go well, right? So, so when we put women in stirrups when they're birthing, that simulates squatting, because it changes the shape of the pelvic opening ever so slightly. If it was profound every time, none of us would be able to walk around. So when we're squatting, what happens to the hairpin turn? Is that what I'm trying to say? Yes. It isn't as twisty. But where's diverticulitis mostly found in the human body? Left lower quadrant. Right?
Yep.
And it can get stuck, and the fascia on the bowel can get stuck to the psoas and iliacus muscles in the pelvic bowl. It's really just a bowl. So I talk about, I don't use those technical words when I'm talking to people as clients. I say, so you have this bowl and there's lots in it, and I go through a little nature walk through there with them. And And then I say, you know, where your bladder and uterus is, which is different for men and women. And women's uterus is on top in women, but the bladder's on top in men because the prostate's in a different location. And people really like to know. I'll give you an example that you wouldn't expect. So I have a lot of clients and a lot of baby boys in my practice over the years. And when they get to be, I don't know, they're playing hockey, like junior A hockey, like 14, 15, 16. And they come in and they've pulled their groin. And because I'm kind of more like an aunt than their doctor, they just strip right down. They go, you got to fix this. I got to get back on the ice. I say, okay. So I check, like, why is the groin pulled? What's happening there? The psoas is not working well, and the piriformis and the sacroiliac joint and the bends around the bowel at the left lower and right lower quadrant. So I do the kind of massage that I teach to do on the belly, which isn't so different than anything, but it's to help the valves work well and the turns work well. And if needed, if kinesio tape, I think, will help. It often won't in the belly because the belly's so undulating, but I use kinesio tape for a lot of other things. And it can be for something like a growing pull. And then I tell them what to do, you know, with it. I might say, you know, put alternating hot and cold and take some arnica or tramadol or whatever. But you really have to check the bowel. Did it get disturbed in all of this? And is the fascia on the iliacus psoas sticking to the bowel? And vice versa. Like, who's the chicken and who's the egg? You won't necessarily know. So what if they have scar tissue from appendicitis surgery? Or what if the woman would have a C-section, a lot of C-section scars that mess all that up. So you have to work with the fascia and the bowel itself. And it's much gentler than you think, like versus having a naturopathic or chiropractic adjustment. It's not like that. It's a touch thing. And it's learning what the touch means. So I try and I've taught this course a few times, called Beyond Palpation. Like, what are you actually feeling? What is it that you're feeling? Are you feeling lymph? Are you just feeling fat globule tissue? Are you feeling fascial tightness? Are you feeling a twist? And one of the big things is to begin to discern between what you're touching. Is it pushing back at you? Is it pushing back on your hand microscopically? If it's pushing back, stop pushing so hard and go to it. And sometimes you put your hand there like you're just hardly doing anything. It's like touching your eyeball, hardly doing anything. And sometimes then it will relax. It's like in a sympathetic dominant state, that tissue. So poking it more, it's just going to get more, it'll push back at you. And everybody and in their personality and everything, you have to learn to listen for the pushback. So working with kids like that, once they know their body can heal much more quickly, because everything's in the right place and it's draining. So I use a lot of kinds of lymph creams, and they might need more magnesium, like things like that. Once they can see in their own body that something's happened, they're yours for life, practically, you know. I saw a guy this week, he's 26 now. I haven't seen him since he was 16 because he went off to university and he works in San Francisco and something. And so he had a jaw problem. So we worked on that. But, you know, it was interesting to see him again because he's taken such an interest in his health. He's a engineer of some kind. There's so many different kinds of engineers. And but he goes in and studies. He was telling me, like, he even knew where the pterygoid muscle was in the jaw. I said, I'm impressed. Because I said, your right one is spasm and it's making the glide of your jaw screwy. Anyway, so the touch is really, really important. I work on newborns sometimes, kids that aren't feeding right, or the projectile vomiting, but usually that is a really tight pyloric valve. And usually the best thing to do is have that tiny surgery where they cut open right there and they open the valve a bit, rather than, it's like one of those surgeries that I always say to them, go now, get it done sooner, because then the baby will thrive. It's very simple. It's not very invasive. So I encourage them to do that because I don't do that, you know. So people come for different reasons. I see people like this guy this week. I hadn't seen him for 10 years, you know. Knew his smile, you know, he's taller, he was everything. Yeah, I have really long time patients, and I have people I see once. They come in, they're referred. They said, so-and-so said to come to see you. And it's usually often belly stuff. Like, had a woman come to me. She was in her 40s. She was Jamaican, woman of color. She wasn't a skinny person. She, you know, had a fuller body, and she had alternating constipation, diarrhea. Once she did have a bowel movement, it was like little rabbit turds. And you already are thinking about, oh yeah. So she sent 3 gastrointestinal specialists, and I listened, and I said, so I'm going to get you a gown that will fit you because it fits me, and you can, you know, leave your underwear on, and I got her all comfortable on the table, and I went to touch her, and I see this tear rolling down her face. I said, did I hurt you? She goes, oh no. She said, I've been to see 3 gastrointestinal specialists and no one's touched me. Well, they did an ultrasound, good for them, but touch can a lot of the time tell you more once you learn. So I said to her, on behalf of, I said, were they all older white men? She goes, yes. I said, on behalf of them, I apologize to you that this has happened to you, that they don't touch you. Internal specialists don't touch anybody. I don't get it, but that's, you know, that's what happens. So her left lower quadrant was that classical hairpin turn. So it turns, but then it goes a half twist often. And so I laid her on her side. I got that untwisted to quite an extent, and I gave her some probiotics, and she was Seventh-day Adventist, so she knew a lot about food from her point of view, and that was great. And I saw her a few weeks later, and her bowel was normal. Now, it isn't always that simple, but I had to do castor oil packs, and she brought me some black castor oil from Jamaica. It's really cool. I didn't know there was black castor oil, and it does different things. And I saw her for maybe a year, and I haven't seen her since, but that doesn't surprise me because everything was working, and that was her goal. And she could be living back in Jamaica. She's doing her PhD here. I can't remember in what, but to hear her story, she's a very gentle but very educated, speaks well, explains well, and nobody touched her. Now, was it because she was too non-white, too big a person, too gentle, and they can't listen to a gentle woman's? There was all kinds of things about that case that got helped by just the way she was treated, you know. And now she's on and off with her life. In terms of, there's a lot of adhesions that can occur in the belly because of surgery, or because of inflammation, or because of chronic bladder infections, that you can work with doing belly massage. And I call it the mashed potatoes, and you just bring the mashed potatoes away from the edge of the bowl. But I teach courses that I only teach 6 at a time. I used to teach 15 and try and monitor everybody, which really wasn't a good idea. But after COVID, I started, well, kind of near the end, started teaching 6 people who are licensed to touch, which could be a practitioner, nurse, massage, physio, chiro, naturopathic. I haven't had an MD in yet, but anybody that's licensed to touch. I won't take students because I don't want them to go back into clinic and not have a supervisor, and then they get yelled at because they're doing something according to the supervisor that they shouldn't be doing. So as soon as you're licensed, you can come, you know. So we do it at my office. I have 2 rooms. We have really comfortable tables. And it's nice to take a class with only 6 people. This past year I had 4 chiros, 1 naturopath and 1 nurse practitioner. But sometimes it's all naturopaths, and some of them have been in practice a long time in a short time, and they get to know each other. It's kind of a social event too. And you get all the slides. I mean, you get everything you need. I have kind of recipe slides. Okay, when you go to feel a belly, do this 1, 2, 3, 4, and you'll just get better at it. And after you feel 10,000 bellies, you'll know what you're doing, or even 100. From babies to elderly people to people with a lot of scar tissue because they've had all kinds of surgery. But it's really calming to the person if they trust you to have their belly touched. And you know that if you have children. I mean, I don't have children, but I know that too. Yeah. So I teach a course called The Belly, what's going on in there. As a chiro, I didn't learn anything about the front of the body. and yeah, another course I teach is, I teach it in body sections, head and neck, and then arms and torso, anything that could happen. People come in and they say, the side of my body hurts. That could be a lot of different things. And depending on what you know, you'll think, maybe it's asthma. You'll think maybe some allopathic diagnosis, or not so allopathic, but a functional thing. Or would they consider that the ribs are torqued? So ribs attached like a pail handle going up and down, but they can also, so this is the spine and this is the front. So the ribs are here attached to the spine and the front, and ribs can do this. They compensate for each other. So remember though that the left thoracic duct comes on the anterior side of the ribs, near the rib heads, adjacent to the spine. And now remember, it's full of half-set jello. It's going up the spine, and it has to go over the lung, but under the ribs and the clavicle to dump into the thoracic duct area. And that, when that's really jammed, when it's really glompy, it feels like there's a knife in the rib. It feels like a knife is stabbing you, and the ribs will be bowed out. Or they've had an accident where they fell off a bike in Toronto on the trolley tracks, and their tire of their bike was caught in it, and they land on their shoulder and their side, and they jam their arm and break their clavicle, almost break their ribs, or they do, but they're jammed in. So if you cut the person in half and laid them down, one side would be accordioned in, like an accordion, and depending on how they hit, they could be flipped more backward or more forward. So like, what really happened to them, and what can things do? Like, the clavicle is a really ignored bone, but the clavicle attaches the breastbone to the shoulder joint at the acromioclavicular joint. And if that joint isn't happy, your arm feels always like it's falling off, Arm feels like it's falling, and it looks like it's usually rolled forward and dangling. So there's a little muscle between the clavicle and the first rib. There's hardly any room. It's called the subclavius muscle. And if you put your hand on your clavicle and raise your arm, you'll feel that clavicle roll backward. But people say, I can only move my arm this far. The subclavius muscle isn't working. Did you feel it?
Yeah.
Fun,
How do practitioners take your course?
You just go online at www.beingwellcommunications.com and look at events, and there they are.
I like it. I found it.
Yeah. So, in fact, I was supposed to be teaching one tomorrow, but there wasn't enough sign up, and it's hard to know when to hold courses because too early in January, we're usually in a snowstorm, and as we get near gardening and then holidays and so on. But I have 3 left this year, I think. Teaching being the belly once, and maybe head and neck twice, or the other one. I think, what do they cost? $240 with tax in. I do have category A for the belly, and I'm trying to get it for the head and neck.
How many, you just do those two, or do you have other
No,
ones?
I have three. Thanks for the prompt. So then I have torso and arms. So what could go wrong? And let me say my arm hurts. Well, what point? They say, you know, it could be something, it could be anywhere all the way along. Oh yeah, you can speak to this, right? Your hand was not happy when I met you.
She does not have a happy hand. No.
Is it still not happy?
No, it's really good now.
Okay. She plays rugby, either very brave or crazy. I never know which one people play.
Number two, number two, and one.
So I do head and neck, then I do belly. Now the belly doesn't include much of the spine. The belly is the belly, because the belly is the first one I'm thinking, what do I know about the belly now that I didn't know 30 years ago? It's like Encyclopedia Britannica series, because I've been feeling them. Once I do it apply kinesiology, but also the mind abdominal massage course really opened up and amalgamating all that, and then working with it, you can really help people. You can really help people. Doesn't mean you're not going to give them a probiotic or say, please stop eating Velveeta cheese or like whatever, you know, those kinds of things, eating glue. So I'm not all about not eating cheese, but glue. So and then the legs and feet, and the pelvis from the back. You know, if I was to teach a 6th course, I would I have a notion to teach one just on hands and feet, because there's lots that, you know, they injure it and then, oh, it's okay. Yeah, but is it 100% okay? Well, I can't undo jar lids, and now I can't knit, or now I can't do working, and that's your hobby. I said, yeah, well, that's a problem. You know, we got to figure that out. Like, I'm a castor oil nut too. Like, when in doubt, you know how people say, when in doubt, you know that wedding, that's moving my big fat Greek wedding, where you put Windex on everything. I put castor oil on everything, or lymph cream. I mean, I've had kids come in like 5 or 6. They go, I've been really sick with a cold, and I've taken Echinacea, and I put lymph cream on everything, and I need something. I need a remedy. I said, okay, jump on. And then sometimes, sorry for them to keep the clothes on. They just go jump on. And then sometimes, and I'm tired of this. I think I need a flower remedy. I said, okay, let's figure it out. Echinacea. I love the Echinacea. or this 2-year-old that got unfortunately run over by a car, but nothing, quote, broken, the kids said, but she was twisted. And they brought her in, and her parents, unfortunately, are the kind of people that faint at the sight of blood. She wasn't that bloody, but she was really scratched up. This girl's 16 now, and her hamstring got ripped a bit, and I put blue light on her right away to take the inflammation out of the system. And as I'm turning away just to grab something on my counter, she starts to talk to me, but in a screechy, scared voice. I said, what do you want? She said, I need arnica. I thought, my job is done with this kid. You know, like, she's 2 years old and she can tell she needs arnica. I thought, okay. But then I worked on her like very subtly, osteopathically, to try and begin to unwind her. And then after 3 treatments, she had been toilet trained before she had the accident. And her mother was just so disgusted because she was peeing again on, you know, back in diapers. And I said to her, she could talk, and she had a great curiosity, this kid. She was maybe just 2, I don't know. And I said to her, why are you doing that? She said, she goes, it's a surprise. Like, she doesn't even know she's doing it. And so when I checked her uterus and bladder, it was jammed. So I moved it up into her abdomen. She never did that again. But it's always good to ask the person living in the body, even if they can hardly talk, because, you know, they have the inside story. I mean, they
Literally,
live it.
intended.
Yeah, they live there. That's why, like the 5-year-old scientist, I say, can you point where your tummy hurts? She goes, it hurts everywhere. And sometimes more in other places. She said, no, it's just everywhere. And she was very bright and very, like she was being as accurate as she could. And it was this overall global feeling. Often it's a spot or two. But don't disbelieve them. So and then I touched her belly very gently. Said, does it, what I'm doing hurt? She goes, no, it doesn't hurt. But for her, there was a strain in her belly that maybe had to do with stress, maybe had to do with this, maybe had to do that. In the end, I gave her under drainage remedies, which seemed to test well. So anyway, so I teach these courses, and it's hard to know. I'm not a super intelligent advertiser, and to get stuff out there, I'm really baby steps. I put it on different sites and so on, but I appreciate any coaching I can get. So at another time, if you're coaching for that, let me know. So
Sonia's good. Sonia's really good. She's, yeah, we'll come visit you.
okay, good.
Yeah.
So I've taught other things in the past. Like I keep promising the world that I'm doing a proactive breast health course online so people can attend or by a later time. And I started getting into breast thermography in the late 90s, and then was part owner of the medical advisor and part owner of a thermography company called Medical Thermography International, which then kind of demised but got picked up, but I own none of it now. I only owned it for a short time to help the project. Some people,
I wondered about that. Yeah,
Yeah.
I thought that was you, but you're out
Yeah.
now.
well, I'm out of the ownership, although I have helped Thermacam Canada, which is
You like them.
Well, that's the same. It's kind of picked up from that company because the other company went all down.
Okay.
Same reader though, Phil Huckstra, and he's in Texas now.
Okay.
Good reader.
Okay.
But I had clients when I was first in practice who had 2 small children, and then they got breast cancer and died. And I got kind of spiritually ticked off. How could this happen? Like, it really motivated me to look at breast health. And 1 in 4 women that live around the Great Lakes of Canada and the United States get breast cancer. There's something wrong with that statistic. And that statistic was from like 1990. So
Ooh,
what?
I didn't know that.
Yeah. So what is it now?
Bad.
I was one of 4 sisters. I just stood around looking at us. Yeah. So it's a really bad statistic, and it has a lot to do with pollution. It's like the increase in prostate cancer. I never saw a man with prostate cancer under 60 till the 90s. And now very young men are getting very little sperm activity and very, a lot of prostate health. And as soon as boys turn legal age, which I think is 18, I teach them about their prostate. And they usually say, and I've known them usually their whole life. So we're going to talk about your prostate today. And they go, I don't want to talk about that. I said, oh, I wasn't clear. I'm talking, you're listening. Right, they say. They know there's no way out of this at this point. So I have a very non-gory diagram, anatomical diagram. I said, this is where it is. This is what it does. And it's, the fluid for your ejaculate, and you don't want that congested because then sometimes you can't ejaculate. And they go, yeah, they want to know. I say, if you want to have a good sex life, yeah, then you have to look after your prostate. And so I said, eat sunflower and pumpkin seeds organic because they have zinc in them. And once in a while have a cranberry juice, but not with stupid sugar in it, honey or something. I could give them a pill, but they can eat sunflower and pumpkin seeds, and they'll do that. They will do that. I said, just put it in a Ziploc bag, put it in your backpack, just keep eating them. And I teach young women about your breasts, or any woman that has an underwire bra, and I go, are you trying to smother your breasts? Like I can, people say, I say, just take that wire out of there. The cloth is still there. It'll still do the same thing. Stop putting that metal there and strangling your breasts. They're going to turn into swamps. I said, you know, and they come in the breast. I said, I'm going to nag you again. This is where you find a bra that works like an underwire bra, but isn't an underwire bra. I could rant about that for a long time. So I want to teach a course called Proactive Breast Health. And if you ask most women, if you ever had breast pain, they go, nope, right away. I said, you answered that too fast. Try again. They said, everybody has breast pain. I said, yes, but it's not normal. Oh, it's not normal? I said, no. It's like if you had a pain in your eyeball, would you think it's normal? No. So why do you think breast pain is normal? Well, it's just what we're fed in our culture. And that your breasts have to, they're either for feeding babies or someone else's sexual pleasure or voyeurism. But are you happy and comfortable about your breasts? So there's this great website called www, and the number 007, like 007, with a capital B or lowercase b, I think it's capital.com. And it's pictures that women take of the breast, just a breast shot, and they talk about how they feel about their breasts. And it's very interesting because there's every age that breasts that have breastfed women who are very elderly and have wrinkly, saggy breasts, and it can really vary. That, like the wrinkly said, you know, the 80-year-old says, my breast fed 5 children, and I'm so thankful that I had my breasts, and on and on. But the Playboy bunny perfect breasts, you know, the ones that point upward, you know, after 16, that doesn't happen. I mean, these are, anyway, pointy up breasts, at least in our culture. They talk about how terrible and ugly their breasts are, and just these are probably perfect looking women according to Hollywood, but they're not happy because they're like they're big enough, not too small. You know, it's really, really sad. But I encourage mothers to take their pubescent girls to the website, like the mother or father, fathers, you view it first, because don't take my word for it, and then say, let's look at these different breasts. Like there was one woman at the time, I haven't looked at it in a while, that had breasts that kind of came out like a stalk, and then the nipple was bigger than the breast. They looked like mushrooms. And she really liked her breasts, that woman. I can remember that. It's just such an interesting thing. So how many women get to look at other people's breasts? Unless you're in a same-sex relationship as a woman, or your doctor or whatever, it's not very common. And it's in our culture, it's very anticipatory for younger women. And this is, it was a very safe website when I last looked at it. So if you're going to look at it, review it before. So don't take my word for it. Go and see what you think. But it's a place where you can go and look at breasts. It's like a place where you can go look at noses. You can, you know, like you just want to know. Like some people could have an abnormality, like their lower lip is just, I don't know, it's out there. You know, then you could go and look at all the different kind of lips that are in civilization. Like it seems odd that we just have that kind of perky, perfect, whatever breast, and that we don't help people appreciate their body.
Pretty much our culture in a kind of in a nutshell.
Yeah.
Yeah.
So
I mean, I want to kind of chat with you further about what we can do to get people watching your Legacy Project videos
Sure.
and contributing, right, to the Legacy Project videos, because that's a huge part of what you talked about in the beginning with, you know, when we do lose, unfortunately, our colleagues, we lose things that we never even heard of before sometimes.
Yes, that never even heard of, like radionics, for
Yeah.
example. And so I had a very good friend. He was also a chiropractor and naturopath, and he died suddenly in 2012. And a very small amount of money was given to the OAND in his name. And what should I do? What should we do with it? I said, we should start at least interviewing and videoing naturopaths, which of course you're doing. So that's applause to you. But I also got from the college at the time, the teaching college, that we could have different people give lectures on something we're really passionate about. Helena Ovens, before she passed, she did one on just emergency homeopathy, but she was in great form that day, and was a very funny woman. And I taught stuff on lymph, and Jacob Shears taught, who's an DCNT as well, but he taught all about brain injuries and what he did. So we have 14 of those classes. The young naturopaths at the time really begged me to do a new patient exam. I said, but my new patient exam is very informed by kinesiology and chiropractic. So I really have that bent to touch people. But I did do a new patient exam, and it was in 3 stages, because it's when I do the exam, it takes a long time, but it was, and we had a little, we always had people participate up to 25. So they learn how to do, biomechanical muscle testing, and I think 2 of the 3 films have category, but the last one doesn't, and we've been stuck in a loop with Kono for a while, and I don't know if that'll ever be resolved, but it's one of those things that can happen when you're trying to share knowledge and trying to get category A or B. So there's that on there, and so there's lots of they're very low rent. You can also become kind of a member of the legacy, because we self-support, because and we raised a little bit of money. We charge people a very small fee to take the courses while we were filming, but we want to teach naturopaths to interview each other. So at the Saskatchewan conference and at the Ontario conference, I handed out a little postcard, and it just says, so say I'm interviewing Sonia, and I say, tell us your name and how long you've practiced and where you practice. And so then the next questions are, what are your favorite modalities? Thanks for putting that up. What are your favorite modalities? Yeah, here are the questions. What are your top 3 modalities? And that's really interesting to hear about. What's a clinical peer that you want others to know? What is the most gratifying experience you've had in practice? What is the most surprising thing you've seen in practice? And we did this with 6 naturopaths in Saskatchewan, an elder panel, and I thought it went really well. And Sonia, you were there. What did you think?
Before or after I was bawling?
Well, tell them while you were bawling.
So Susanna Sarenko, Dr. Susanna Sarenko was our first naturopath, and she taught us about belly breathing, and I had gone to see her because after our dad passed away, I stopped sleeping. Like, just stopped sleeping. And my mom maybe had seen her. Krista, you had seen Susanna, and you said, well, go see her. And I think she gave me a remedy, and she gave me a tincture, and she taught me to breathe, and I could sleep again. And see, I'm gonna cry now. I can't cry, but
please do. It softens all our hearts.
So then I saw Dr. Sarenko in Saskatchewan, and I told her that you're one of the big reasons I became a naturopath. And then during the elder panel, she was asked, what was your most gratifying experience you've had in your practice? And she retold that story, and
yeah.
And so, I did this for a long time.
Yeah, it's good. It's good because it's very real and it's heartfelt. And I saw after we'd done that elders panel, I walked over and rubbed Sonia's back. I said, how are we doing? And she goes, I think what you said to me was, I wish we had this in all provinces, and that this way of thinking that the elders were talking about. Is that what you said to me?
Yeah.
Yeah, because I mean, there are days, my mother's mother, my grandmother was like the best cook. grandmothers seem like that way to children. But we've tried to duplicate her apple pie about 1,000 times. We have the recipe, but we don't quite get there. I always swear we need more nutmeg in it, but you have to know that you don't know something. And then someone teaches you to breathe. And how basic is that? And it changed your life. If you weren't sleeping, changed your life. So we need to keep passing on this elder knowledge. Like, I think by what things I've already told you today about frozen shoulders at a mite of the limb, for the sore lateral breast, or the left lateral breast really takes it in the air when it comes to drainage of the breast, and just things that, if you see the water, you'll drink the water. I can tell you that really works. You have to put it in clear containers so you can see it. Or if you're eating too fast, put the fork down, chew it, then pick the fork up when your mouth is empty. You can train yourself to do that, and it really works. So the Legacy Project is it really got knocked around in COVID, and so we're trying to regroup. And a lot of the people that work with me, there's about 5 young naturopathic women, they have children, young children. And so it's hard to get things done. It's, we've been reaching out for 10 years now, and we've been in this pandemic storm, I'll call it. And so a lot's happened in the world. But if we can get to things like the World Naturopathic Federation and have people contribute a bit, but interview each other just with that little card, because then you can send us the film clip, and then you could interview each other the next year, or in 10 years, or in 50 years, like, who are they then? Like, Scott Clack has just written a piece for the CANDE newsletter. I'm getting senior naturopaths to write these, and he just talks about how do you get your practice going and how do you get busy in 200 words. We only have 200 words. But I've just seen it, edited it, and Bob Van Horlack did it the 2 months before this, and before that I did a lot of them. But now I'm starting to ask people that have been in practice a while just to write whatever they want to write about. Like, what do you want people to know? What is the thing that they should know? And some of these things seem too simple, but we need to educate our parents, because now we're in a time of, if somebody's watching this in the future, that we're in great jeopardy in Ontario, in Canada, with regard to our supplements. Just happened in this last week, whether we'll have viable supplements available. But maybe we'll just be teaching people to grow herbs and how to use them. We don't know what's going to happen, but you can't stop. I mean, it's the right thing to do to keep going, but I can't not do it. And that usually, once you're a naturopath, it's a vocation. It's not a hobby.
Yeah.
And so what do you think about final thoughts? What are the final thoughts you have for your colleagues, your young colleagues?
Yeah. Well, there's a lot of things, yes. Make sure you take time for yourself. I say that so I can hear it. Save money. Save 10% of what your net earnings are. So you have a rainy day bag. Find out what you're passionate about. Could be hypnosis, could be high velocity adjusting, could be dream analysis. I don't really care what it is. Just do it. Just do it, and it'll change and it'll morph. Get your own healthcare, whatever that is, done for you. Make sure you're not just giving, you need to receive. Have time alone. And get together with your colleagues. Could be just one-on-one. Have a mentor. That doesn't necessarily mean someone older than you. Could be someone younger, because they're like kind of like your muse. Like, I mentor some people, but they mentor me too, because they ask me things. Like, for example, somebody phoned me in a real estate because she had a request from an insurance company to give her just the file and so on and so on. And they thought the licensing body was coming after her. I said, no. They're just asking you for copy of the file. They'd been there 2 visits and the costs, and charge them a little bit, and that'll be fine. And then I said, you were taught it, because at Chiropractic College, we were taught this, but that was way back in the 70s, but you were taught how to write a medical legal report, right? She goes, I don't know what that means. I said, oh, so then I asked someone who'd been in naturopathic practice for over 20 years. I said, you were taught to write a medical legal report, right? Nope. And I'm thinking, what's going on with that? Because say somebody had something happen and you were some kind of caregiver for them, primary or secondary, and you saw them through these 10 years when they were trying not to jump off a cliff, like whatever it's about, your file will be subpoenaed, but you also may have to write a report on what your diagnosis was and this and that and why. And
Okay,
now
what is it called again?
a medical legal report.
No, we're 20 years out.
I know.
Okay.
I asked somebody 25 years out the other day.
Yeah.
If that was a thing that they learned, they're a person who's like on all this stuff. She said no. I went, how could that be? Because we want to be seen as legally presentable in the public. But if we want to be able to dance with the others, we have to meet them on their ground and in their language. I mean, naturopaths always end up talking about poop. Fine, I understand that. But how do you talk to someone who hasn't considered drainage, a biome? Now everybody thinks they've discovered the biome, but you know, who's your audience in that case in the legal system? Like, always think that. Who's my audience? It's this 5-year-old girl. It's these naturopaths. It's these naturopaths in these cohort. Or it's anybody who's allowed to touch legally healthcare. Like, who's your audience? Like, how can they hear you? Like, where are they listening from? And in the medical legal world, it's who's to blame.
Mm-hmm.
And if they call you, you're just as much of a target as who's to blame than anybody else.
It goes back to listening, right?
Yep. Thank you, Dr. Verna Hunt. That's amazing. Now I have like this huge piece of homework hovering over me for the weekend, but I'm like, I don't even know what that report.
I'm gonna come hug you right now. We're gonna leave here.
No.
and
I'm the one that doesn't like to be touched. She's telling on me. I hugged a patient thinking about you, Dr. Hunt, today. I was like, Dr. Hunt is making me so great. And eventually we're gonna come to you're in Toronto, right, Dr. Hunt?
I am. I'm in the Junction.
Yeah.
High Park.
We're gonna
come do your source.
Yeah, share this far and wide and get people doing the Legacy Project interviews. And I think
Yeah.
We'll let you go.
Anybody that would like to be involved with the Legacy Project, which they're curious, and doesn't have to be a lot of time, and if you've been in practice 20 years, you can write a column too. That's my cut-off point. I just arbitrarily picked that.
I like it. We'll attach your information at the bottom of this little video, but we'll also come see you, because we know how to share things, and if we can like share our audiences but make sure we keep talking about it, then we'll give it legs again. Thank you very much. You have a good weekend.
Thank you so much.
Bye.
Thank you. How do we do this?